11 years on. It's 11 years since the first mother of an autistic child phoned me up and told me her story, and it seems like many lifetimes ago. I am a gastroenterologist, and I would like to talk to you principally about the gut and autism and our work in it. How many people here is this their first biomedical conference? A lot. There's something in this talk for everyone. It does get quite complex as we move through it, but try and stay with it, and you'll probably take away 10 facts. I usually take away about 3 facts from a talk. But there is something in this for everyone here. Are there many physicians here? Hands up, any physicians? See, that's a tragic indictment of really where we are with this disorder. A brief history. This is Leo Kanner, known to you. In 1943, described 11 children with this extraordinary and idiosyncratic pattern of behavior that merited publication in its own right. I allude to this because this is the classical way in which human disease syndromes are described. In a handful of individuals, usually no more than 15 to 20, who have a unique constellation of signs and symptoms, a pattern of presentation that are new and merit publication in their own right. There are no controls. You don't know against what you're controlling. And this then serves as the template, if you like, for our future understanding of the disorder. And these children were so unusual that had they existed in the past, I'm quite sure that they would have been described. The great physicians who've lived on this planet really aren't even of the last century. They're of the century before and the century before that. People like Charcot in Paris, who described the features of neurosyphilis, amongst other things. And these people were brilliant diagnosticians. They could pick up physical signs. They could do nothing about many of those, but they were absolutely outstanding at describing clinical disease. So had this existed, I have no doubt that it would have been described before. Kanner, interestingly, was the first person to report on gastrointestinal disorders in children with autism in that same paper. In 7 of the first 11 patients, they had self-restricted diets, vomiting, diarrhea, what he described as avitaminosis. I'm not quite sure what that means, and malnutrition. But, sadly, the practice that is still common of ascribing physical symptoms in children with autism to some sort of psychological reaction also started with Leo Kanner. Our patients, anxious to keep the outside world away, indicated this by the refusal of food. And this is a tragedy, an absolute tragedy, because this then created the mindset that perpetuated through the years that these children had a psychological, psychiatric problem and that their physical symptoms were secondary to that. Now, there is a fundamental rule of medicine, and that is that symptoms in a patient have an organic physical basis until proven otherwise. You do not leap to the conclusion that this has a psychological or psychiatric basis until you have excluded all other possibilities. If you do so, then you will make dreadful errors. If you put the gastrointestinal symptoms of, let's say, a 50-year-old woman down to irritable bowel syndrome, then you will miss her cancer of the colon. That is what will happen. And so you exclude that cancer of the colon, and then you come to the conclusion that it's irritable bowel syndrome. So where does medicine begin in this extraordinarily complex situation that you are faced with a child with autism? Where does medicine begin to unravel the question? And the starting point in clinical medicine is with the history. You listen to the patient, or in this case, the patient's parents, and you take their story at first hand and you investigate it to the best of your ability to establish what is valid and what is not. And then you examine the patient. God forbid you put a hand on, for example, the patient's abdomen, and this probably has not happened for many, many of your children. And then you conduct special investigations which are based upon what you have elucidated in the history and the examination that then lead you finally to the diagnosis. So the clinical history in the children, as they presented 11 years ago and still continue to present, was for us in the clinic, and this clearly doesn't apply to every child with autism, but it is an important starting point. Normal early development. They'd met all their milestones, then developmental regression into some sort of atypical autism but with regression, onset of neurological and gastrointestinal symptoms. So as well as regressing developmentally, losing speech and language, interaction, social skills, and other things, they also developed neurological features. The children became clumsy. They started bumping into things. They could no longer eat with a utensil. And these hard neurological signs indicated a clear physical basis to this problem until proven otherwise. Interestingly, the children suffered from recurrent infections. This was something that we heard time and time again. In the first 2-3 years of life, upper respiratory tract, ear infections, multiple courses of antibiotics, and I'm sure these features are common in this population here as well. And then re-challenge events. The parents would say my child was normal until they had their MMR vaccine, and then within a few weeks they started to lose skills. And what was interesting about this is that then parents whose children had gone on to have a second dose of the vaccine at 4 years had developed subsequent more severe regression, subsequent more severe physical symptoms. And this re-challenge effect is extremely interesting. So, if in doubt, examine the patient. Here's a little boy, one of the first children I came across from the US. This is a little boy who was developing entirely normally, and here he is with some of the classical features of autism, but also the reason for showing you this is that this child is wasting. His ribs are poking through, he's emaciated, and there is something wrong with this child physically until proven otherwise. Pain. Pain manifests in strange ways in children who cannot articulate their symptoms by saying, "Mum, I have pain." And so these sorts of behaviors where children will lean on things for hours at a time have been interpreted as a manifestation of autism. This is just behavior that occurs in children with autism. No, it is not. No, it's not. It's not just autism. This is a child who is doing something entirely appropriate. He is putting pressure on his lower abdomen to relieve the discomfort. This little girl did the same thing. She leant on a stool. This little girl would lie on her hands. This little guy would sleep like this. And this little boy would sleep like this. He'd actually sleep on this ball with his head on his dog as a cushion. And we know that this is due to pain, because when you treat the underlying bowel inflammation in these children, they go to bed and they sleep normally. And they don't wake up at night fractious and disturbed, screaming, crying. They sleep well. This is a sign described by an English surgeon called Gray Turner. This is self-injury. This is bruising in the flanks. You can see this little girl has got a grossly distended abdomen, and her response to this is self-injury, to try and mitigate the pain. She is hurting herself. And this is a little boy who is doing the same by beating his head against the wall. This again was put down to autistic behavior. It is not. This is a child who cannot articulate his pain, who is banging his head against the wall to render himself unconscious because of his abdominal pain. Medicine was able to contribute nothing to this child's care until his mother put him on a special diet, and this completely went away. This is a little girl from Phoenix who is autistic, and she has some other manifestations of intestinal inflammation. She has red and inflamed eyes, uveitis, and this is a feature that we see in patients with Crohn's disease and ulcerative colitis. She also has this arthritis, a deforming arthritis, which again we see as what we call a systemic manifestation of inflammatory bowel disease. She also has bruising from self-injury due to her pain. So there are many physical signs in this child that indicate an underlying inflammatory pathology.